Summary: glaucoma is a very serious eye disease that can lead to blindness if not treated early. The best way to diagnose glaucoma is to have regular eye examinations, especially if you're above 40 years of age. With early diagnosis and treatment, most patients with glaucoma can save their vision and continue to enjoy excellent quality of life. What is glaucoma? Glaucoma is an eye disease that causes loss of sight by damaging a part of the eye called the optic nerve. When glaucoma damages your optic nerve, you begin to lose patches of vision, usually side vision, also called peripheral vision. Over time, glaucoma may also damage straight-ahead vision or central vision. Many people who get glaucoma don't even know that they have the disease. If left untreated, it can lead to gradual vision loss and, over a period of time, total blindness. Normal vision and glaucoma. The transparent part of the eye located in front is known as the cornea. An extra layer called the conjunctiva also covers the front part of the eye. The back of the eye is called the retina. Light enters the eye through the cornea and is focused onto the retina. The retina changes light signals into electric signals. These electric signals are sent through the optic nerve to the brain, which translates these signals into the images that we see. The eye has a front or anterior chamber and a back or posterior chamber. A clear fluid called aqueous humor collects in the anterior chamber of your eye. The fluid then gets drained through a spongy meshwork in an area called the angle. If the fluid does not get drained on a regular basis, it builds up in the anterior chamber. When the fluid builds up, pressure and tension inside the eye increase. This increase in pressure causes damage to the eye and the optic nerve, resulting in the condition called glaucoma, which if left untreated can lead to blindness. Types of glaucoma. There are different types of glaucoma. Open-angle glaucoma. In this type of glaucoma, pressure in the eyes increase gradually. Open-angle glaucoma is the most common type of the disease. Low tension or normal tension glaucoma. In low tension or normal tension glaucoma, the symptoms do not occur slowly, as in open-angle glaucoma. Pressure in the eyes may increase without warning. Closed-angle glaucoma. Closed-angle glaucoma is a medical emergency. This type of glaucoma produces a sudden increase in eye pressure. Symptoms include severe pain and nausea, redness of the eye, and blurred vision. Without immediate treatment, blindness may occur in 1 to 2 days. Usually, prompt laser surgery can clear blockage and save eyesight. Chronic angle closure glaucoma. The term chronic angle closure glaucoma refers to an eye with a high intraocular eye pressure. The anterior chamber is narrow and closed in places by adhesions so that the iris cannot free itself. This could be a result of previous intraocular inflammations. Eye medication to reduce the intraocular eye pressure can be given, and if this is not sufficient, then laser surgery called iridotomy is performed. Congenital glaucoma. Congenital glaucoma affects children who are born with eye defects that slow normal fluid drainage. However, with surgery, these children have a good chance of clear vision. Secondary glaucoma. Secondary glaucoma occurs due to the complications related to other medical conditions such as eye surgery, advanced cataracts, eye injuries, certain eye tumors, untreated hypertension or high blood pressure, untreated diabetes or high blood sugar in the blood, prolonged use of corticosteroid medication. Symptoms of glaucoma. In the early stages, glaucoma may have no symptoms. However, in a few people, eye pain and headaches can occur. Without treatment, people with glaucoma may find that they suddenly have no side vision or peripheral vision. It may seem as though they are looking through a tunnel, also called tunnel vision. Without treatment, patients with glaucoma may continue to lose vision until blindness results. The following factors can put you at a higher risk of getting glaucoma. Age above 40 years, untreated high blood pressure or hypertension, untreated high blood sugar or diabetes, a family history of glaucoma, short-sightedness or myopia, prolonged use of corticosteroid drops, tablets or ointments. Tests and diagnosis. An early diagnosis of glaucoma is vital to prevent vision loss and blindness. Only a detailed eye examination can help detect the disease. Tests for detecting glaucoma include visual acuity test. In this test, your doctor will use an eye chart to evaluate how well you see at various distances. Tonometry. This is a simple, painless procedure with which your doctor measures your intraocular pressure after numbing your eyes with drops. Gonioscopy. This test is done to determine the angle at which the fluid in the eye drains out. A special lens is placed in your eyes to inspect the drainage angle. Visual fields test or perimetry. The visual fields test measures your side or peripheral vision. It helps your doctor find out if you have decreased side vision, which is an indication of glaucoma. Ophthalmoscopy. In this test, the doctor uses a handheld device to look directly through the pupil into the eye. This procedure is done to examine the optic nerve and check for signs of damage. Pachymetry. During pachymetry, the eye is numbed with drops and an ultrasound probe is used to measure the thickness of the cornea. Treatment options. The treatment for glaucoma falls into two categories: medication and surgery. Both modes of treatment manage the disease by lowering the intraocular pressure. Medications and eye drops are common remedies, but if the intraocular pressure cannot be controlled by medications or eye drops alone, then surgery may be recommended. The surgical goal would be to drain the intraocular fluid by expanding the existing drainage area or by creating a new outlet for the fluids to drain through. Medications are usually the first line of treatment in glaucoma. Medications can be in the form of eye drops and pills. Some medicines work by causing the eye to produce less fluid. Certain other medications work by lowering pressure in the eye, by helping fluid drain out. From all of the available choices, a reasonable initial approach would be to choose an eye drop that will get the eye pressure as low as safely possible in each particular patient. The choice of the initial agent is guided by the patient characteristics and associated medical conditions. Steps to administering eye drops. Before each use, wash your hands, shake the bottle, remove the screw cap and place it in a clean, dry area. First, hold the bottle upside down between your thumb and middle finger. This allows the product to flow directly into the dropper. Second, gently tilt your head back and position the bottle above the eye to be dosed. Do not touch the eye with the dropper tip. Third, place a finger under your eye and gently pull down until a pocket is made between your eye and lower lid. Fourth, gently squeeze the sides of the bottle to dispense 1 drop of medication. And Fifth, keep your head tilted backward and close your eye for 1 to 2 minutes to allow absorption of the medication into the eye. It is important to keep using drops or pills as long as advised. Do not stop medication without consulting your doctor. Surgery. If medication cannot control eye pressure sufficiently, surgery may be recommended. Depending on the type of glaucoma, laser surgery is commonly performed to treat glaucoma. Often, you may need to take medications even after laser surgery. The types of laser surgery include laser iridotomy, laser trabeculoplasty, laser cilioablation. During laser surgery, your eye is numbed with special eye drops. While facing the laser machine in a sitting position, your doctor will hold a special lens on the eye. A high-energy beam of light is aimed at the special lens and reflected onto the meshwork inside your eye. You may see flashes of bright green or red light. The laser beams enlarge the drainage holes in the meshwork. This opens the holes and allows the fluid to drain out.